a 9-year-old girl is brought to the pediatrician by her parents because of unremitting cough, fevers, night sweats, anorexia, and weight loss for 4 weeks. Her vaccinations are up to date. When asked about the recent exposure to a sick contact, the parent mentions that she is frequently under the care of a middle-aged woman who recently immigrated from a small rural community in North India. Her temperature is 102.2, respiratory is 30, heart rate is 120, her weight is 2 standard deviations below normal for her age, chest auscultation shows fine crackles in both lung fields. The patient is referred to a nearby children's hospital where her clinical condition rapidly worsens over the several weeks. A chest radiograph is shown below. Microbiological evaluation of bronchial aspirate reveals an organism with a cell wall that is weakly gram-positive. Which of the following describes the cell wall of the causative agent? So this is the X-ray, and these are the options. Option A is low muramic acid, B is high mycolic acid content, C is high ergosterol content, D is absence of cellular wall, and E is teichoic acid-rich cellular wall. I'll show the question again. You can go through it, and then you can see the options. All right. Okay, quick diagnosis. What is this? All right. So yeah, I'm asking you the diagnosis so that you know what is being talked about, right? Very good. Pulmonary tuberculosis. All right. So yes, it all gives out in the question. It's a very direct question that fever is there, night sweats are there, weight loss and everything is there. Vaccination is up to date. That's okay. That's not required. And she is in contact. The child is in contact with someone from India, like a woman from India who is from rural India. So basically, they're all directing you towards tuberculosis. Okay, and the question mainly asks you why tuberculosis is weakly gram-positive and not proper gram-positive, because it has high amount of mycolic acid content. Okay, so there is one thing which you have to know. It's written over here also. So the mycolic acid is present in more than 60% of the cell wall, right? Other things are also present, but majority is the mycolic acid. Now, what mycolic acid does is it makes the cell wall less porous, all right? And this makes it difficult for the gram stain to penetrate into it. And it not only protects the pathogen from antibacterial agents, but it also causes it to stain poorly. Like mentioned, that is why it is weakly gram-positive, all right? So it also resists de-staining when treated with acid alcohol. Therefore, it is termed as acid-fast. This is the reason why it is acid-fast. But why is it not very strongly gram-positive and weakly gram-positive is because it has more of mycolic acid and less of peptidoglycan and all. This is responsible. Peptidoglycan is for the gram-positive stain. All right. And when you have more of mycolic acids, that means more of lipids or something. That means it gets difficult for the bacteria to stain. All right. This is all you need to know. If there was more of peptidoglycan which is present in the normal gram-positive bacteria, it will stain better. It will retain the stain. Is there any other doubt in this?
Thanks for watching. Please give a thumbs up and subscribe for more.